I'm Sudipto Srivastava. I'm with the Mount Sinai eHealth team, work with Daryl and others. So I met Eran back in 2015 November. When he was also the CEO of Somatix at a Connected Health conference. And he came up through a mutual sort of friend that we had, and we made the connection. He said, I have this algorithm and this platform that can actually tell you when somebody's smoking. And I was like skeptical because we've been dabbling in digital health for a while, and we kind of joke internally with our stakeholders and even with us that digital health is a faith-based initiative. You've got to really sort of believe in it and say, really, how does that work? So we of course asked Eran a lot of questions about how can you tell the difference between when I'm eating versus when I'm smoking, when I'm scratching my ears versus smoking, and so on. Well, here we are since from 2015 to now. And what Eran and his team have been able to do is they've really been able to take all the noise that's out there that is generated through your sort of smartwatch sensors, which is what they use to run their algorithms against, and create signals from it. And that's what digital health is looking for, where all this noise is out there, and how do you translate that into meaningful signals that you can take action on, and then take it to the next level is, you prod your patient to not smoke or other things that Eran will sort of talk about. I'm also proud of the fact that we recommended Somatix to the program. It was accepted and is doing great. Primarily because we feel that they've been good partners to us. They've been good partners not only because Mount Sinai being a 40,000 employee company, where there are different innovations that happen all over. So sometimes even we are at a loss as to where's the next innovation taking place. So Eran's been a good partner in bringing it up and saying, did you know that Mount Sinai is doing XYZ in smoking cessation, so that we can reach out to the right stakeholders, and that's been extremely helpful to us. I wish the company best of luck because they're looking at a great future. In December, they're in the process of sort of securing $6 million in sort of Series A funding. They're building their own sensor in China, which will be faster and smarter than some of the sensors in watches right now. And they're doing pilots in several countries. I think USA, Canada, Turkey, Israel, and also planning China and France, and so on. So without further ado, Eran.
Good afternoon, everyone. My name is Eran Ofir. I'm the CEO and co-founder of Somatix. Movements. It's all about movements. That's where we started our journey. We believe that detecting and monitoring body gestures basically provides ocean of opportunities for helping people making better health choices. And let me explain you how. So we have developed a technology, let's start before. We have developed a technology in which we take the raw data from sensors that exist on any type of smartwatch and wristband, and we analyze that data in real time, and from the movements of the hand in space, we can tell what's the activity that that person is doing, whether he's eating, drinking, hot or cold, smoking, shaving, biting his nails, and brushing his teeth, and so on. And from here, we take it to many different use cases. So this is how we use it. First of all, we collect the data, that real-time data continuously throughout the day. Then we analyze it in our cloud-based servers. Once we analyze it, we start intervening. We provide 4 different types of incentives: social, emotional, rational, and financial. And we collect the data over time about the response of that person to the different types of incentives. Once we have that, we build a psychological profile of that person. And once we have the psychological profile, then we start changing the dosages of the incentives that we get, or that we provide, in order to get to a higher efficacy. Of what? Of the treatment plan that was provided by the clinician, by the physician, because that's where our customer is. So this is how it's working continuously in order to get to a higher efficacy. Now, we work on all devices, basically. We are device agnostic. We don't care about the platform. In fact, later this year, we are going to offer to our partners, basically the enterprise customers that we have that are health insurers and clinics and corporate employers, our own smart pen that is currently being developed and produced in China, which will be a cheap one, $40, and will provide a lot of functionality. And this is something that will be provided only to our partners. There are many different gestures that we can identify. You can see some of them here, some of them has been developed, some of them will be developed throughout the year, thanks to the funding that we are now getting. And what are the technologies that we're using? So there are three main core technologies. The first of all, that hand-to-mouth gesture detection that was explained already. The second one is the analysis that we do in our cloud-based servers, where we get all that data. Now, just to give you a feeling about the amount of data that we are talking about, we are capturing and saving over 500,000 data records per person per day that we are then analyzing in order to find insights and to find correlations between different activities that that person is doing throughout the day. Only for that part, for the data analysis, we were certified by SAP that are now presenting us globally to their healthcare customers as a company that is using novel technology, providing insights, predictive analytics, based on big data that is captured from smartwatches and wristbands. And the third component is what we are doing with professors all around in different countries, as Sudipto mentioned, where we took methodologies of CBT, cognitive behavioral therapy, and of ACT, acceptance and commitment therapy, and we translated those methodologies into basically machine learning algorithms that we apply through our cloud-based servers. So these are the technologies. We are using them in order to create clinically actionable data. And from that, we go to interventions that are helping people, basically, and are making treatments work much better. Now, the first three markets that we're identifying and that we are approaching, first of all, it's addictions control. Eating disorders, drinking problems, smoking cessation, bulimia, and so on. The second one is elderly care. Just with providing an elderly person who lives alone at home a standard commercial off-the-shelf smart band, we can tell how much that person is eating, drinking, smoking, sleeping, whether he was phoning, accelerometer and barometer, and notify immediately the caregiver. We even provide on our enterprise dashboard graphs to the caregiver showing whether there was a deterioration in the health condition of that person or improvement in the last month, like following a treatment that he received. And the third market is early identification of neurological diseases. Because currently, I'll give you an example. In order to find early symptoms of Parkinson, you need to hospitalize a person at the hospital, and then they place sensors on the hands, and they measure in 2 nights the tremors. While we have shown that we can predict, that we can find the signature of the tremors when a person is sleeping in his bed at night, basically, with a standard smartwatch. So these are just some use cases. The first product that we introduced to market is SmokeBeat. Why? Because smoking is the number 1 preventative cause of death globally. We're talking about 500,000 Americans that are dying every year from smoking. We're talking about 28% of the European adult population who are smoking. In Asia Pacific, it's an epidemic, with 330 million smokers in China. Now, you're trying to understand why is that? Like 50% of the smokers are trying to quit on average 10 times throughout their life, whereas only 7% manage to get to permanent smoking cessation. And why is that? When we ask clinicians what's happening, they tell us it's a broken process because we prescribe a treatment and then we have no tool for telling the adherence and the compliance of a person with the treatment that was provided. And this is what we are solving. We detect, we analyze, and we provide support. Now, and basically the patient is getting an app on his phone. The physician basically is getting a tool for remote counseling the patient and for monitoring the adherence and the compliance, and they are being reimbursed also by remote counseling codes. The provider, the clinic, not only that they see now the data of the individual, now they see the efficacy of all the treatments that they provide for their entire patient space. And obviously the payers, well, first of all, it's cost reduction because now treatments are better. And second, that the competition currently between insurance company is on their ability to do dynamic pricing, competitive pricing based on the healthcare. In fact, 1/3 of the insurers in the US are now utilizing wearables in order to engage with their customers. So the three things to remember about us: it's proprietary and patented technologies, it's effective and proven psychological methodologies for behavioral modification that we are using, and its opportunity for implications in some mega markets of the healthcare industry that I mentioned before. So I encourage you to contact us for a demo, and thank you for your attention.